My name is Mario Di Cato. I come from Luxembourg. And my task was to see if there was something in relation to ESAs in oncology, ESA use, new in this year. I mentioned November because we are a few weeks before ASH. So there will certainly be some data there. Just to set the stage, here you can see the pooled analysis from Heinz Ludwig, which was published end of last year, and which showed no difference in overall survival, including long-term follow-up in this large number of patients treated with, so this is individual database. And if you look at the progression-free survival, it's the same thing. There's essentially no difference. So this comes with the issue of Henke and all the other problems over the past few years. So I thought we should start with this type of slide. What is new in iron therapy? Well, we were left with the conclusions of several studies on iron, which are very favorable. And this is one of the studies, the Pedrazzoli study, where you can see that the hematopoietic response is in favor of those patients who were on iron. But, and that's why I mentioned ASH, this was presented last year at ASH. This is a Mayo Clinic study where the different patients given placebo, oral or IV iron did not show any difference in hemoglobin response or in transfusion requirements. So this was presented and in an abstract form only available as of now, and the update will be at ASH a few weeks from now. In addition, in this study, if you look at the side effects, 8 in IV iron, 6 patients died in the oral arm, 3 in a placebo arm. This was not statistically very significant, but the side effects were significant comparing the two groups. And there was no less consumption of erythropoietin. What happened during this year was there are a lot of publications on inflammation and basic biology. And I'm just going to show you this old slide from 1996 by Norouzian, to which I added the new data over the past few years of hepcidin and the mechanisms of iron availability and the discussion about IV and oral iron, which goes into all of this. So this is a repeat of the stage where we are at. There is some data on anemia of chronic disease. TNF is a major player in this, which has a direct effect on genes that are involved in hemoglobin expression. I'm not going to go through the details. GATA1 is also one of the major players in this story, and maybe Joachim will tell us more about this. A few interesting articles on non-erythroid effects of erythropoietin. Well, you have seen that over the past years, that there have been a whole series of papers on this issue. Here is a recent paper, in fact, was published a couple of weeks ago, on the effect of erythropoietin on macrophages, and this is the editorial that comes with it. Very interesting paper showing that you have pro-inflammatory as well as anti-inflammatory activity of erythropoietin. This erythropoietin enhances functions of macrophages. A similar effect has been shown on dendritic cells and also on the expression and increase of survival and function of dendritic cells by erythropoietin. There's always the issue if dendritic cells and macrophages, they come from the same ancestor cells, at least in a mouse, and the question is, can this be transposed to humans? Macrophages may produce functional erythropoietin, and as I mentioned before, you can enhance or attenuate inflammatory response in some models with erythropoietin, delaying the TNF-alpha story and decreasing also the other cytokines. So macrophages can be a target for erythropoietin. So this is basic science biology. This comes from Arkesoy, from the editorial I just mentioned. And the reason I'm showing this is not new, it's just a new form. I think Joachim and myself, we were involved in a discussion about this type of slide some time ago about a paper. But what is interesting is that there are some publications about the effect of erythropoietin on foam cells, decreasing the amount of storage of lipids in foam cells and having an effect on atherosclerosis. This is not in human. Another interesting paper, which I'm not really sure about, that I would like to discuss later with Joachim, is in Science, and there are several papers in Science on ESAs. There are also a couple of papers in Cell. This is an interesting paper looking at the processing of the erythropoietin receptor, which is inside the cell, compared to the amount of receptors on the membrane. And the paper shows the influence of the intracellular quantity of EPO receptor on the functional membrane receptor, which you would expect by upregulations of production. But it also shows the influence of the amount of erythropoietin on the receptor, having an effect not on what we usually look at about erythropoietin and hemoglobin production, but on the receptor itself. So what does the ligand do when you have large amounts of ligands compared to less amounts of ligands to the number of receptor on the membrane? So this is an interesting paper, and there are many like that. Now, regarding the clinical data, there is not that much new during this year. On the clinical data, this was a kind of editorial. It's not a real editorial, but it was a kind of editorial in the New England Journal in January. And despite the fact that we saw from one of the previous speakers an excerpt about transfusion, there is practically nothing on the transfusion story in this reevaluation. So I didn't really see what the purpose of this paper was. But what is very interesting is a large study. This is a prospective randomized study done by a German group in Hodgkin's lymphoma using erythropoietin alpha in patients who were given BCOP, which is a rather aggressive chemotherapy schedule. And if you look at different, I don't know if you can see that from here, but if you look, for instance, the death rate, there's no significant difference. The cause of death, there was no significant difference. And if you look at the amount of transfusions, there was no significant difference. And here's the summary, if you want. This here is the overall survival. There is essentially no difference. So in fact, overall, there was no difference between the placebo group compared to the ESA group in this large study, so hematological malignancy. It was a large study, 1,300 and more patients, of which around 900 have been evaluated completely. And overall, you can say survival, progression of disease, number of transfusions, practically no difference, no deleterious effect at least. Thank you.